Assessment and Evaluation of Medical Students, ROJoson TPORs. TPOR stands for Thoughts, Perceptions, Opinions, and Recommendations. Learning objectives: know the differences between assessment and evaluation in medical education. Given a description of an activity or task, identify whether it is assessment or evaluation being done, and know the relationship of tools to measure students' learning to assessment and evaluation. Loosely used assessment and evaluation may mean or connote the same thing in determining the amount of knowledge, level of performance of skills, and scale of attitude present or acquired by students before and after a study. In such a case, they are oftentimes used interchangeably. Strictly speaking, however, most educators say assessment and evaluation have different connotations or meanings and should not be used interchangeably. Unfortunately, they are not unanimous in stating the differences. This is the reason for the confusion on the two terms. I have researched on the issue, and I will give my thoughts, perceptions, opinions, and recommendations on the differences between assessment and evaluation and in the context of a medical school. That's why I entitled this manuscript as Assessment and Evaluation of Medical Students, ROJoson TPORs. In determining the amount of knowledge present or acquired by students before and after a study, also the level of performance of skills and the scale of attitude, both assessment and evaluation can and are usually used. The main question is, what actions constitute assessment and what constitute evaluation? The most important thing to know and to remember is that the starting point of the difference between assessment and evaluation lies within the intent of use. If the intent of use is to make a judgment on the quantity and quality of the student's learning, then evaluation is the right term to use. If the intent is to monitor learning, identify strengths and weaknesses, and provide feedback on the areas of improvement, then assessment is the right term to use. To formally define each term, assessment is the process of gathering information to monitor on students' learning and performance, whereas evaluation is the process of analyzing, reflecting upon, and summarizing the assessment information, and then making judgment and/or decision on the quantity and quality of students' learning or performance. Simply put, assessment is diagnostic, whereas evaluation is judgmental on the quantity and quality of the student's learning and performance. If both assessment and evaluation are used, assessment comes before evaluation. Assessment is conducted during the learning process, whereas evaluation is usually held at the beginning the end of the learning process, such as at the end of a learning activity, a chapter, a topic, a course of study, or at end of study period, such as semesters, trimesters, or years. Thus, assessment is concerned with process and is process-oriented, whereas evaluation focuses on product or is product-oriented? Examples are given below for better understanding of the differences between assessment and evaluation in the context of a medical school. A teacher gave a pre-test before the formal learning activity. This pre-test is assessment. At the end of the learning activity, the teacher gave a post-test. The post-test is evaluation. A teacher wanted to determine the amount of knowledge of the students acquired after a course of study over one semester or trimester. The teacher gave a written test with a predetermined passing score of 75%. What the teacher did was an evaluation. Those students who got the grade of 75% or higher passed the course of study, whereas those below 75% failed. This is part of the evaluation process. There was a judgment and decision made, and which students passed and which students failed. A teacher gave a series of quizzes and tests during the course of a study over one semester or trimester. The quizzes and tests were graded. The teacher should decide whether the series of quizzes and tests would be diagnostic and formative, meaning to monitor learning, identify strengths and weaknesses, and provide feedback, or would be part of the final grade in the course. If just diagnostic and formative, then what the teacher did was an assessment. A popular specific term for this is formative assessment. To differentiate it from the summative assessment, which will be expounded below, if the scores will be part of the final grade in the course, what the teacher did was an evaluation. Thus, as can be seen in this example, evaluation can be done during and within the course as long as the teacher decides there is to be an accompanying judgment or decision on pass or fail on the test to be administered. Note there is a dichotomous term for formative assessment mentioned above that is commonly used by the educators and which may cause confusion on the differences between assessment and evaluation, connoting overlap or seemingly can be used interchangeably. The term is summative assessment, and this is synonymous with evaluation. So summative assessment is synonymous with evaluation. Take note, this is the only time when this kind of assessment, namely summative assessment, is the same as evaluation. Summative assessment is defined as a method of evaluation performed at the end of a learning unit or course of study that allows a teacher to measure the student's learning and/or performance. Another example, on assessment and evaluation of skills of students, the teacher used continuous and intermittent observation with a checklist and rating scales to determine the levels of performance of skills of students. He decided that he would continuously and intermittently give feedback to the students on their levels of performance with scores on the checklist and rating scales being used. Doing so, the teacher is doing an assessment, meaning he is monitoring the level of performance, identifying weaknesses and strengths, and providing feedback, etc. If at the end of the course of learning, the teacher decided to give one last act of observation with one final score or grade, then he is now doing an evaluation. On assessment and evaluation of attitude of students, a teacher used continuous or intermittent observation and analysis using a combination of checklists and rating scales, reflection papers, or projects to determine the scale of attitude of the students. By the time that the teacher is asked to give a final judgment on the attitude of the students, usually at the end of the observation period, the score or the grade that he will give constitute an evaluation. Before the evaluation time, the scores that he was giving during the observation and analysis period constitute an assessment. During assessment, he was monitoring and providing feedback to the students on their attitude. The medical school administered a comprehensive examination at the end of the second year and fourth year of the medical school. The passing score is 75%. These comprehensive examinations are considered evaluation. There were some students who failed, some passed. There was a judgment and decision made on which students could be promoted to the third year and which students would be allowed to graduate. At the end of the medical study, the medical school administration determined who would pass and who would not be allowed to graduate. The medical school administration determined the ranking of the students and decided which students would be given awards and recognized with honors. All the above actions constitute judgment and therefore evaluation and not assessment. However, take note that evaluation make use of all assessment information from start to end of the medical study to make judgment and decision. A last word on the relationship of tools or procedures in measuring students' learning to assessment and evaluation. Test, examinations, and quizzes are popular terms, just as there may be confusion and interchangeable usage on assessment and evaluation. Test, examinations, and quizzes at times are used also interchangeably with both assessment and evaluation. Again, there is or are differences among the tools or procedures in measuring students' learning, which are exemplified by tests, exams, and quizzes, assessment, and evaluation. Tools or procedures in measuring students' learning are not limited to tests, exams, and quizzes. By the way, quizzes connote smaller or shorter tests and exams, and tests and exams can be synonymous, but examination is a more formal term. Basically, there are at least three categories of tools or procedures in measuring students' learning. These are test, observation, and projects. There could be more. Examples of common tests being done are written tests such as paper, pencil, digital or online tests, and oral exams, either face-to-face or tele or online. Example of common procedures being done using observation are the practical exams, the objective structured clinical examination or OSCE, and observation of performance skills and attitude using checklists and rating scales. Examples of projects being done to measure students' learning are case study and discussions, management of actual problem-solving situations, research projects, and learning and reflection portfolios, etc. Statements or policies describing the relationship of tools or procedures in measuring students' learning to assessment and evaluation are the following. The tools or procedures for measuring students' learning are not always for assessment nor for evaluation. They can be used in both assessment and evaluation. The objective of the tools or procedures has to be spelled out, whether they will be diagnostic and informative or judgmental and summative. I hope I have covered all these learning objectives. Know the differences between assessment and evaluation in medical education. Given a description of an activity or task, identify whether it is assessment or evaluation being done. And lastly, know the relationship of tools to measure students' learning to assessment and evaluation. So that ends my short talk. Thank you for your kind attention.